Hi, my name is Lucia. I'm a nurse practitioner student at GW. I am going to do a physical exam of the abdominal system, the musculoskeletal system, neuro, as well as spine. Before I begin my exam, I'm going to go over there and wash my hands or use an approved hand sanitizer. And our patient today is George. We're going to start the assessment with the musculoskeletal, with the abdominal system. George, I'm going to pull over your gown. We'll begin with inspection of the abdomen. We're going to inspect the abdomen for contour. So I'll pull your gown over so I can expose your abdomen area and your chest. So we assess the abdomen, inspect the abdomen for contour and also for symmetry. As you can see, abdomen is symmetrical. We also inspect for shape. The shape is almost flat. We inspect for pulsation, and there is no pulsations of any vessel. Also inspect for scars and protrusions. As we can see, George has a scar right over here, but there is no protrusions or masses. The next part of the abdominal exam is auscultation of the abdomen. We're going to divide the abdomen anatomically into 4 quadrants: the upper left, lower left, right, upper right, and upper left, upper right, lower left, and lower right. So the abdomen has normal active bowel sounds, appears to be gurgling bowel sounds. So following that, we will do auscultation for bruits, beginning with the descending aorta. And there is no bruit. The left renal artery, no bruit. Right renal artery, there is no bruit. The left iliac, no bruit. And the right iliac, there is no bruit. After that, I will proceed to also auscultate the femoral arteries. So the right femoral has no bruit. The left femoral has no bruit. The next part of the assessment is percussion of the abdomen. I am going to percuss the bladder, the spleen, locate the border of the liver, and just a general percussion of the abdomen as well. I'm also going to try to locate the border of the liver using the finger scratch test. So we might stethoscope I would start from the lower abdomen. And as I scratch, it appears, I'm going to do that again. So the border of the liver is right where it ought to be, so there is no concern for hepatomegaly. I am going to locate the spleen and the bladder by precaution. So I could not feel the spleen, however, which indicates that the patient has a normal size spleen, and also the bladder. We're going to do a light palpation of all 4 quadrants. So I'm going to press on your belly, and if it hurts you, just let me know. So we did the right lower, the left lower, the right upper, and well, the left upper and the right upper. So it appears Judge didn't complain of any pain, so that was an okay exam. Then I'm also going to palpate the femoral artery, which will be located right here. This is the right femoral, and there is no bulging or any pain. And also the left femoral, no bulging. And I will also check the inguinal nodes, and there is no node. I cannot feel any node in this area. The next part of the exam takes us to deep palpation of the liver, the spleen, and the kidneys. So I am going to, with my left hand and the support of my right hand, push down to look for enlargement of the liver or the liver border, and appears to be okay. And then for the spleen, I'm also going to push down so that's okay as well. And for the right and left kidney, while using my hand to support the lower back, you're fine, George, just like relax. Okay. I'm going to push down as well. On the left side, I will do the same, and I can't really feel the kidney from this. So take a deep breath, George. Let's try again. Take a deep breath and hold. Blow out. Okay. Good. Thank you. Take a deep breath. Blow out. From here, we'll be moving on to the musculoskeletal system, and we'll start with inspection of the lower extremities, as well as the upper extremities. Okay. So I'm going to look for scars, and it appears George has a fair number of scars on his lower extremities. And I'll also look at the bottom of his feet. Looks okay. No scars or any redness. I'm also going to inspect your hands. Okay, let me see your hand. I'm going to look at that arm over there as well. Very good. No scars or any redness. And what I forgot to look was to see if there is any lower extremity edema. And looking at the lower extremities, there is no edema in the ankles or on the upper aspect of the foot. From here, we're going to do some range of motion assessment, and I'll be checking for assessing for strength of the lower extremities first, and also range of motion exercise of the lower extremity. So we'll do rotation of the hip, starting with the right hip. So George, I'm gonna have you kind of twist your leg, like this right leg, move it around while I support your heels. We'll go like in a circular motion. Do you have any pain? Okay, we're gonna do the same here. Circular motion. No pain. We're going to do flexion. All the way as close to your chin as possible, keeping your head down. Okay, good. Extend this leg, extend all the way and out. And in, take it in all the way towards, so this is the adduction. All the way, see if you can cross it to that side. Okay, no, flat, straight down, the same level, but across as far as you can go. Okay, good. Now, bring it back outward, and this is adduction, and moving it towards the core of the body. Towards the core is adduction. So adduction with A, B, adduction. ADDUCTION is bringing the leg, as George did, towards the medial part of the body, and then abduction is out, as he did, all the way away from the body. And we'll do the same with the left leg. So you're going to lift this left leg up, and then we'll move it. First of all, we did the rotation exercise, right? Range of motion. And then we're going to do away from the body. So we'll move the leg away from the body, and then bring it back in. Does that hurt anywhere?
No.
Okay. And we're going to do flexion of the hip. Bring it as close to your chin or chest as possible. Any pain?
No.
Okay, you can keep that leg extended. We're going to do, can you rotate this ankle for me? Let's see, just your ankle. See if you can move it. There we go. And then how about this one? Around, okay. Now we're going to do, I'm going to move your toes as well. Just check the range of motion of your toes, and seem to be okay. Any pain anywhere,
No.
George? Okay.
No.
We'll do some resistance activity. So with your so push my hands down, which push. Okay, we're gonna do the same now. I'm gonna push your leg. I want you to push my hand upward. So use this. We'll use your right leg and push my hand up. Good, very good. Okay, that's good. We'll do the same here so we can compare. Push down. Good. Now push my hand away. Very good. We'll do the same for the hip. So my hand is under. We'll lift your leg. Push my hand down. Good. And then we'll do the same. Up. Okay. How about this leg? We'll do the same for this. Push down. Push my hand down with your upper thigh. Yeah, push. Good. Now push my hand away. Okay. So I'm gonna do the same here, okay? Push my hands with your foot. Just your foot, George. Use your foot to push my hand. Good. Let's do the same with this. Very good. Now, push my hands away. Push me away. Okay, good. All right, thank you. Then we're gonna try to bring the legs, push, so I'll put my hand in the middle, then try to push my hand. Good, very good. All right, and then we'll do the same here, push away. Okay, good. So I think that activity we just did was abduction and adduction of the hips and knees, flexion and internal external rotation of the hip, and then we also did inversion and eversion of the ankles, as well as dorsiflexion and plantar flexion, and also range of motion and strength of the toes was the activities we completed before. So George, I'm going to ask you to sit up. So we'll start with inspection and palpation of the upper extremities. So I will assess the shoulders and clavicles and the acromioclavicular joint, bilateral. So first of all, start with your arm, inspection of the arm. I think we did this before, but we'll just do it again. And then the shoulders appears to be symmetrical, and there is no signs of atrophy anywhere. And I'm going to check the back. Of course, the camera can't see this part, but I can see that the back is symmetrical. There are no signs of erythema or any bulges. However, there is a couple of scars on the left shoulder, as well as right below the right clavicle. Yeah, so I have to also check your joints, beginning with the elbow. Okay, and here. Good. I think I need to drink some water. Okay, I think before I left to get some water, we inspected the elbow, and now we're going to do the fingers. So the palm is fully formed. Can I see this one? Okay, no signs of atrophy, and the joints are pretty flexible and movable. There is no rigidity or any deformity. Okay. After inspection, range of motion of the shoulder and the elbow. Those are the two things we'll be doing. I think, if I'm not mistaken, I think I did the joint already of the fingers. So just range of motion of the shoulder and range of motion of the elbow. So let me get rid of your gown. So with the elbow range of motion, we're going to do abduction and adduction. So I'm going to have you flex the shoulder and then extend. Okay, can you do it one more time? Extend in. So with your hands out and then flip it around. Okay. So we're going to do the internal and external rotation of the shoulders. So I'll have you bend this to the opposite side of your body. Yeah, and touch your shoulder. Bend and touch the shoulder. Okay, do the same. No, one at a time, one hand at a time. So you're done with this, put this one down, and then do the same for that. Then I'm going to have you, okay, you can put this hand down now. So with the right hand, lift your arm up all the way. Okay, and down. Next one, up and down. So we'll do forward flexion and extension. So starting with the back, extend. There we go. All right, then bring it back. And then to the right. And now this one to the left. And then up. Okay, you can put your hand down. Thank you, George. We'll do supination or pronation of the elbow. So supination and pronation of the elbow, flexion and extension of the elbow. So we'll start with flexion and extension of the elbow. Okay, George. I'm going to have you bend both hands. Okay, and then up and out like this. Good. And then flip it around. And then turn around. And then we're also going to do, hook it up, covers it. That's it. Thank you. We're done with flexion and extension and supination and pronation of the elbow. And flexion of the wrist. So you're going to bend the wrist, bend at the wrist, and then lift up your hand. Good. And then flat. Thank you, George. Abduction, abduction, and adduction of the wrist. So we're going to bring your wrist with your arms spread out, then try to bring the wrist together like this. And then out, away from the body. Good. Thank you, George. We're going to do hands and finger grip. So bend the hands, and I'm going to try to pull it back. So when I pull it back, I want you to pull it towards you. Okay, so get ready. 1, 2, 3. Good. Very good strength. 1, 2, 3. Good. And then then finger grip. With finger grip. Okay. And with this one, when I'm going to hold your hand and pull back. Then here, pull back. Okay. So opposition thumbs. So here, I'm going to pull your finger, so pull out of my hand. Okay, then this one. So inspection of the curvature of the back, which is what I'm going to do, and I did that already, but I'm going to do it one more time. So we'll be inspecting the back to sit upright for me, and I'm going to look at your back to make sure that it's properly aligned, and that's the case here. There is no scoliosis or kyphosis or lordosis. So the back is up, anatomically intact with no deformity of any nature. And also I will palpate the cervical spine, thoracic, lumbar, and the paravertebral muscle. So we'll start with the cervical spine. No, with your head up, lift your head up, upright, yeah. So I'm gonna palpate, just let me know if it hurts. So done with the cervical spine. We'll go to the thoracic spine, palpation, and the lumbar spine. And I think after that I have to do the paravertebral muscle. So just let me know if it hurts as I press down on the tissue around the spine. Do you feel any pain anywhere?
No.
Okay. The next part of the assessment is mental status. We're going to neurologic assessment, beginning with the mental status. So we'll do orientation to place, time, and person. What's your name?
Josh.
Do you know the day? What day it is today?
Today is
Okay, it's the 6th. That's okay. What month is it?
March.
George, it's March?
April. Sorry.
Oh my God, George, we'll have to start all over. Okay, what's your name?
I'm Josh.
Okay, what month is it?
It's April.
Okay, what year is it?
2015.
What's the name of the President of the United States?
President Barack Hussein Obama.
Okay, thank you very much. Unfortunately, I've not been very current with the news, so it's hard for me to pick out an event or a recent event that George did, but I was just asking what he had for breakfast or lunch. It's almost 5 o'clock in the evening, so what did you eat for lunch?
I took bread and coffee.
For lunch?
For breakfast.
For
For
breakfast.
lunch, I took rice.
Okay, all right. And let me see, for remote memory, I can say, let me see what I can think of. We can, let's say 2 days ago. Today is Monday. Yesterday was Easter. So what did you eat for Easter?
Plantain.
Dinner.
Plantain and beans.
Okay. So I'm going to ask you I'm going to say a phrase, and then you can tell me what you think it is. Birds of the same feathers flock together. What do you think that means?
It means people of the same character,
Mm-hmm.
people of the same always work together.
Okay. I'm going to ask you to speak a little louder so our camera can pick it up. So, birds of the same feathers flock together. In your opinion, what do you think that means?
It means people of the same character, they always work together.
Okay. All right. I'm actually, do you need something to drink? Because I'm thirsty and I need to drink something. Okay, we're going to do the next set of assessment will be Series 7s. I'm sorry, I'm actually dry. So we're going to start from 100, and then you can count down by 7. So if it's 100, subtract 7 and tell me what the next number is, and as far as you can go. Make sure my camera is functioning here. Okay, yeah. So starting from 100, so count down 7.
Okay. 193. 193. 86. 86. We have 79. 79. We have 72. 72. We have 65.
That's good. Thank you, George. You got it. From here, we'll be doing the cranial nerves, beginning with cranial nerve 2, which is the optic nerve. And we are going to, let me see if I have it right. Yeah. We are going to, I'm going to do what we call confrontation of the visual field. So I'm not going to hit you in any way, but just to let you know that I'll bring my hand close to your face. So I want you to just look up, just look at me, and I'm okay. That's the assessment. And as you can see, Judge blinked immediately and moved his head backward in reaction to the confrontation assessment. The next cranial nerve we're going to do is cranial nerve 3, 4, and 6, which is oculomotor, trochlear, and abducens. And with this, we'll be assessing extraocular movement. And that will be beginning, I'm going to do a letter H, and I will have George follow my hand movement. So what I'm going to do is I would, with my hand or my fingers, design a letter H in the air. So all I want you to do is, without moving your head, just follow the movement of my hand, okay? So George was able to follow my hand movement as I formed the letter H. The next cranial nerve we're going to do is the trigeminal, which is I would be doing if a fine touch of George's forehead, his cheek, and his jaw. You see, I think my equipments are here. So I want you to tell me with your eyes, you have to keep your eyes closed, and I want you to tell me when you feel me touch your forehead, your jaw, cheek, forehead, cheek, and jaw. All right, eyes closed. This away. We're going to do the cranial nerve 5, trigeminal. So I'm going to ask George, I'm going to ask you to clench, to like tighten your jaw, clench your jaw, and move your cheeks from side to side. So tighten it down, and then, yeah, move from That's funny. Okay. Just the facial expression. I'm sorry, I have to laugh. I'm also gonna as part of the assessment of the fifth cranial nerve, I am going to also palpate the temporal muscles and the masseter muscles. Okay. So here, you just tell me if you feel anything here. Okay. Up here. It's okay. The next part is cranial nerve 7, which is facial. So, Judge, I'll ask you to elevate your eyebrows. So, move the eyebrows up, okay? And also close your eyes tightly, like really tight. Good. Then do a frown, the best frown you can. Okay, that's better. Now smile. Puff out your cheeks. Out. Puff. Good. Thank you, George. Cranial nerve 8 is acoustic. So I'm going to test for hearing by whispering. So whatever I whisper, you can, if you can hear me, you can tell me what I did say loud enough so we can capture it on video. You have to close the other ear. So put your hand, I think, let me do it. You keep your hand down, then I'll close the other ear.
Football. Game plan.
So apparently, after closing the ear on both sides, apparently Judge was able to say what I told him in a whispered voice. I'm also going to do the Weber and Rhine test with my tuning fork. So I will put this on your head, and you tell me when it stops, when you stop hearing the vibration, and then I'll bring it and put it right here, and you can tell me when you stop hearing the vibration. Okay. Do it again. Put it, and then I'll check the other ear. Okay. I think I'm gonna redo that again one more time because of technique. So I will tap the tuning fork, put it on his head, and he will tell me when it stops, and then I'm gonna put it on the mastoid, and then he will tell me when he doesn't hear it anymore. So tap it. Okay. So behind the ear.
Stop.
The next part is the gag. The next one is the cranial nerve 9 and 10, which is glossopharyngeal and vagus. So I would have George say a phrase, and I can just hear what he says, listening for any. No, I'm going to do just the gag reflex. So with my tongue blade, I think I lost it, yeah, right here. So with the tongue blade, I'm just going to say it without actually causing George to gag. With my tongue blade, I would have George elevate his tongue, and when George elevates his tongue, so I'll have him, no, I don't want you to do it, so it's okay. But what we'll do is, with you opening your mouth, lifting up your tongue, the soft palate moves up. The soft palate moves up. And with my tongue blade, I'll go to the back of the throat. On either side, I will touch the back of your throat, and that will cause you to gag, which is the response that I would like to see. The next part of the assessment is cranial nerve 11, spinal accessory. So we'll be assessing strength of the sternocleidomastoid by a shoulder shrug and head turn. So I'm going to put my hand on your shoulder. I will ask you to shrug both shoulders against my hand. With this, we'll test strength. So, no, just relax. Put my hand and then push up against my hand. Lift, shrug your shoulders like. Push my hand up. Okay, then I'm going to push down while you push up. Okay, good. And they had equal strength on both sides. There was no sign of atrophy. I didn't see any asymmetrical or unevenness in strength. We're going to do the head turn. So I will put my hand on your cheek, and on each side I'll ask you to push against my hand. So I put my hand, push. Okay. Again, good. Align your head properly. Okay, with my hand, push my hand. And you can note the movement of the sternocleidomastoid. And then here, I want you to push my hand again. Push, push. Okay. And then we'll see the same movement of the muscle on the other side. The next part is the cranial nerve 12, the hypoglossal. With this, I'm going to ask you to stick your tongue out as far as you can go. Okay. So we'll assess for symmetry. There is no deviation or no signs of atrophy. Okay, that's good, thank you. And also with the hypoglossal, we'll also check the movement of the tongue and the mouth. I will ask you to use your tongue to push one cheek out. Good, and then do the same on the left. Thank you. Okay, I'm going to ask you to read something. Or maybe I'll just ask you to say something. Like, let's just say I went to the market today, something like that. I want you to repeat that.
I went to the market today.
Okay. So speech is clear, smooth, and distinct. So no issues with that. So after the cranial nerves, I think that was the last of the cranial nerves. We're going to do cerebellar function assessment. So with that, let me see. So with both your hands, you lift up your hands and then pat the knees. So you do something like lift up your hands, pat your knee, up, down, and I want you to do it fast, like quickly though. I want you to touch, so up, down, quick. Okay. That's good, George, that's good. Okay. So you were able to keep a very good pace and rhythm. That's a normal finding. We're going to do the finger to nose test. So I'll put my hand here, and you touch my hand and touch your nose. We'll do it with one hand and then with the other. So touch and to you. Okay, bring it back out. Do it fast. 1, 2, 1, 2, 1, 2. Okay. With the next one, do the same. 1. Fast, faster. Okay, that's good. So again, it was smooth and rhythmic, with no tremors noted. Let's see. Okay, we're going to do position sense, proprioception, and with that, I am going to have you close your eyes. Then I would also, what I'll do is sit back a little bit so you, okay. I'm going to move your toes one at a time, and you can tell me whether it's up or down. Okay. Eyes closed, tight.
Up, down, down, up, down, up, down, down, up, up, down, up, down.
Okay. We're going to assess for tremors at rest. So with your hands out, just checking to see, just keep still if you can. Okay, that's good. No tremors noted. You can keep your hand down. At this point, we're going to test sensation. So we'll do a sharp and dull object. Let me get my tools. So with this, let's see. So I am going to touch different parts of your legs, and you can tell me whether it's sharp or whether it's dull, okay? So keep your eyes closed. That's okay. There is clothing, so I can see. So that's good enough. Thank you, George, for that. The light touch. I get my cotton. Okay. So with the light touch, I am going to also gently touch also different areas, and you can tell me if you feel it. So with your eyes closed.
Yeah. 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 Yeah.
Are your eyes closed?
Yeah. 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 Yeah.
Sorry.
Yeah.
Okay. Thank you. Okay. Okay, we're going to also do vibration sense. Okay, so with the tuning fork, I would tap it and put it on George's toe, and he can tell me when the vibration stops. Okay. All right, George. Just keep your eyes closed for most of this test. All right. So the fork is right on the interphalangeal joint of the right toe.
Stop.
And now on the interphalangeal joint of the left toe.
Stop.
Okay. Thank you. So we're done with vibration sense, and then we're going to do object recognition. My key was right here. I'm not supposed to reveal. And I had a coin. You see. Oh shoot! I'm not supposed to say anything. I take that back. Okay. I'm gonna ask you to close your eyes again, and with your palm out. Yeah, just relax your hand. I will put an object in your hand, and I want you to feel it and tell me what it is that you feel with your eyes closed tightly. Yes. So you can put your hand over it and tell me what it is.
The pen. I feel it.
Okay, thank you. The next part of the test is deep tendon reflexes of both the left, right, upper and lower extremities. We will start with the biceps. I am going to check. Relax. Relax. Okay. Good. Yeah, relax. Okay, good. So we did the bicep reflex. So the next one is the brachioradialis, we are going to right here. Yeah, keeping your hand relaxed. Here, no, there, it's good, it's good. Relax, relax. Okay, we'll do the same here. If that was the right, and now we're going to do the left. Okay. Patella. So knees relax, right there. I'm sorry. Okay, I'm gonna do it one more time. Okay, good. Okay, good. Thank you. We're going to do the Achilles. Okay. So right here. Oh, I think I'm blocking the video. Okay, good. Okay. So we're going to do the triceps. So I'm going to have you bend your elbow like that. Relax. Do the tricep reflex. Okay. That hand can come down with this. Relax your arm. Relax your arm. I'm going to support your arm. Relax. Okay. Turn it off that. Hold on, let me do one more time. Okay. We'll do this again. Okay. Thank you. Next one is the plantar reflex to test for Babinski sign. And so just to warn you, I don't know if you're very ticklish or not, but with the edge of my pen, I'm going to slide it across the sole of your foot in an arch. And observe how the toes react, whether they come close together and bend downward or they fan out. So, sorry. Very good. We'll do the same here. Very good. Very good response. Okay, this part of the test I'm going to ask you to stand right here. Uh-oh. Okay. So I will ask you to move a little away from the table. Okay. I'm going to ask you to do a lateral bending and rotation. So by lateral bending, you will bend from side to side at the waist. So you would go left and then right. So bend left as far as you can go, then bend right. Okay, so do you feel dizzy or shaky at all? No. Okay, we're going to do rotation from side to side. So here, we're going to have you turn to, no, yeah, just the upper body. Okay, go ahead, move. Good. That's as far as you can go. Good. And then we're going to do the same here. We're going to have you turn towards that side as far as you can go. Good rotation. Good. I'm also going to observe you walk. So you take 3 steps towards my direction, turn around and walk 3 steps back to where you are. So you can walk towards me. Okay. Walk back. Okay, so that was smooth. There was no issues with his steps. He was able to walk in a nice straight pattern and swinging his arms in a relaxed manner. So the next part of the test is I am going to assess how you walk with your heels to toes, and also walking on your toes and then your heels. So you can walk towards me with the heels like this, heels to toes, no, go back. So you're going to use your heels and then walk. So heels first, toes, heels, then go ahead. Heel, walk. Okay, George, you want to walk back? See, look at what I did. Heel, toe, heel, toe.
Okay.
Okay. Just, okay, go ahead with the heels. Keep going. Come towards me.
Ready?
Yeah, very good. With your heels, good. Okay, now turn around and walk back. So turn around. So he's able to turn easily without any issue. Okay. Okay, now we're going to do toes. So you're going to walk on your toes towards me. Then turn around and go back. Okay. So George's gait was normal. No signs of ataxia noted, and also there was no weakness. I think with that, we're going to do the last part, which is the Romberg test. So with your hands outward, I want you to eyes closed, hands out. Okay, eyes closed, hands out. So George is not swaying from side to side. So that was the Romberg test we just did. Thank you, George. With that, we're going to conclude the exam. Thank you very much.